Hearing your dentist recommend a root canal usually triggers immediate dread, but thanks to modern local anesthetics, the procedure itself is virtually painless. Most patients report feeling only mild pressure and vibration. This guide is brought to you by The Best of Health, the UK's trusted resource for over 50s navigating healthcare decisions. The process is incredibly straightforward. The first step simply involves your dentist thoroughly numbing the affected tooth and the surrounding gum. Next, they use tiny specialized instruments to carefully clear out the infected or inflamed nerve tissue from inside the root. Finally, they completely fill and seal that empty space. This prevents any bacteria from getting back in and preserves your natural tooth structure. It is a routine plumbing fix for a localized infection, not a medical crisis you need to fear. But while the physical procedure is straightforward, the financial side requires a decision. The route you take determines a massive variance in what you pay out of pocket. On one end of the spectrum, your total bill might sit under £80. On the extreme other end, it can easily exceed £1,000. You are looking at a calculated trade-off. You can trade your time on a wait list to save hundreds of pounds, or you can trade your money to bypass the queue and get seen immediately. Both routes deliver excellent medical outcomes. The right choice depends entirely on matching your current physical pain levels to the flexibility of your bank account. Let's look at the NHS route. Treatment here falls strictly under a single fixed Band 2 charge. This one-time charge covers the entire root canal process. Whether you have a simple front tooth that takes 30 minutes or a complex molar that requires 3 separate appointments, the price does not change. The Best of Health research team compiled this information to bring you accurate guidance on the NHS versus private cost comparison, showing Band 2 charges of £70 versus private fees of £300 to £900 for 2026. The major trade-off for this deep financial subsidy is time. You are joining a severe national backlog, which means a typical wait of 4 to 12 weeks before you sit in the chair. Enduring a 2 to 3 month delay is generally manageable for a dull ache. But if you are in acute, distracting pain that keeps you awake at night, waiting is rarely a viable option. The NHS route is a test of endurance. It offers unbeatable financial value to those whose physical symptoms allow them to wait out the queue. Choosing general private treatment allows you to step entirely outside of that NHS queue. You secure an appointment within 1 to 3 weeks. You also get a longer, unhurried consultation window where your dentist isn't rushing between patients. Without the NHS subsidy, your out-of-pocket costs jump significantly, ranging from £400 to £900, depending on the tooth. If you have a complex, multi-rooted molar, you might need the higher tier, upgrading to a private specialist, known as an endodontist. These specialists use advanced surgical microscopes and rotary instruments to navigate difficult root structures, achieving a 90 to 95% success rate for teeth that might otherwise be lost. This expertise pushes the treatment price into the absolute premium tier, landing between £800 and £1,500. Private care operates as a premium tax. You pay it to regain immediate control over your schedule and to instantly stop severe pain. Once the procedure is done, your tooth is saved. You will likely experience some sensitivity for a few days, which you can easily manage with over-the-counter painkillers like ibuprofen. But the physical reality of the tooth has changed. Because the living nerve is gone, the tooth eventually dries out, becoming brittle and highly vulnerable to fracturing under the pressure of chewing. Leaving a dead tooth exposed is risky. A follow-up investment in a protective artificial crown is practically mandatory to keep it intact. This adds a completely separate charge to your bill. A crown adds £332.10 on the NHS, or between £500 and £1,200 if done privately. To see the true financial picture of saving a tooth, we have to look at the total stacked costs. On the NHS route, combining the root canal and the crown keeps your overall total near £400, the absolute lowest available ceiling. By contrast, combining a private root canal with a private crown pushes the final financial burden well over £1,000 and sometimes closer to £2,000 for a specialist. Budgeting for the root canal is only half the financial journey. The crown is the necessary final step to protect your entire investment. Medically, you can rest easy knowing both routes offer excellent 85 to 95% success rates, likely securing your tooth for a decade or more. Making the final choice boils down to matching your immediate circumstances to the right pathway. Determine your physical discomfort. For a manageable ache and a fixed budget, follow the No branch to the NHS. For agonizing pain, follow the Yes branch to private care. For a complex molar, follow the Sub branch to a specialist endodontist. Mapping your exact pain tolerance and budget against this flowchart completely removes the guesswork from a stressful medical decision. There is also a highly effective compromise that blends the best of both systems. You start by getting the highly affordable NHS root canal. This clears the infection, stops the decay, and stabilizes the tooth at a low cost. Then, for the second phase, you pay privately later for the crown to ensure better aesthetics and long-term durability. While this hybrid route requires patience through the initial waitlist, it optimizes your overall cost while still securing a premium quality finish. For more definitive guides on dental costs and choosing the right care for your needs, visit The Best of Health at thebestofhealth.co.uk. Whether you trade time on the NHS or money in private care, making a deliberate choice puts you back in control of your long-term health.